Okay, we're going to instruct our patient in different types of lifts. So the first lift is a deep squat or a traditional lift. This is for heavy or very large objects. So you're going to instruct your patient to position his or her feet on either side of the object. Squat so that their hips are at or below the level of the knees. So this is the big thing with the deep squat. So Courtney's bottom is below the level of her knees, okay? They're gonna maintain an anterior pelvic tilt. Their lumbar spine is in slight lordosis, so you can see the curve there. Upper extremities parallel to one another, grip opposite sides of the object, and bring the object close to the body and lift with the legs. Excellent. Now, the power lift is exactly the same, however, it's a half squat position. So you're going to instruct your patient's feet parallel to each other behind the object, half squat position so the hips are above the level of the knees. Trunk at 45 to 50 degrees, anterior pelvic tilt, lumbar spine in slight lordosis, upper extremities parallel to each other, grasp opposite handles or sides of the object, bring it close to your body and lift with your legs. Excellent. Okay, so that's the power lift. Then we're gonna go over the straight leg lift. So you're gonna instruct your patient to face the object with one leg forward, shift the body weight onto the forward leg, and lean forward to 80 to 90 degrees of hip flexion to where your trunk is parallel to the floor. The leg in the back is extended as a counterbalance. Then you're gonna reach for the object with the arm on the side of the forward leg or both arms, depending on the weight of the object, and pick it up and return to upright position. Excellent. Now we're gonna instruct our patient in the half kneeling lift or the half kneel lift. This is really good for people who are smaller or people who have weak upper extremities. It is contraindicated for people who have knee or joint problems, okay? So if you have a patient who's had a recent knee surgery or they have severe arthritis in their knees or any sort of knee issue, you're not going to recommend this lift, okay? So we're gonna instruct Courtney to kneel on one knee behind and slightly to one side of the object. The other leg positioned on the other side of the object with the foot flat and the hip at 90 degrees of flexion. Perfect. So the trunk is gonna remain in normal lordosis throughout the lift. They're gonna reach for the object with both upper extremities, grasp on both sides, and move it to the thigh of the kneeling leg. Good. Bring the object close to the trunk and then rise to stand. Excellent. Okay. And then the last lift that we're going to talk about is the stoop lift. So you're going to instruct the patient to stand on one side of the object, feet positioned at shoulder width with one slightly forward. You're gonna stoop by partially flexing hips and knees, maintaining lumbar spine in normal lordosis, grasp the handle or object of the handle or object arm of the object, and then straighten legs to lift. Good. Excellent.